Good morning. So today I'm going to go over two different career choices that are actually pretty great choices in my opinion. The first one is going to be someone that you've probably seen anytime you've gotten lab work done, anytime maybe you had to check on your blood cell counts, maybe to see if you're anemic, check your thyroid. There's so many different options. That would be a phlebotomist. So what they do is they take blood normally through a needle in your arm, your wrist, and they collect blood samples for testing. So not only do they get trained in just retrieving samples of blood, but sometimes they also have to deal with like stool samples, urine samples. I know when I was pregnant, I had to go see one of these phlebotomists quite often. So for routine blood work and for urinalysis every time I went to my appointment. So they also have to be trained in getting blood from different capillaries. So if you only need a small amount of blood, that could be like a finger prick, maybe a prick to your heel. Also, like the other things I mentioned, your wrist can also be done. I know you can do it in your foot. So there's a great deal of different places that you can work. First, of course, be in a lab, since you are going to be taking blood and dealing with that. Hospitals, doctors' offices, and you will especially see them at like American Red Cross, different blood donors like that. So to be a phlebotomist, it's actually like a non-degree program. You can go to a technical school, an occupational school. It's typically about a year long. So you'll have classroom instruction and some clinical hours also. And some places do require you to get a certification for that. The hourly wage starts out like $12.95, so right around $27,000 a year. The average salary is about $17, a little bit higher. It can be like $35,500 a year, I believe. Some of them are a little bit higher than that. So nationally, they're expected to grow about 22% in the next 10 years. So, which is pretty great. I mean, most jobs are not climbing at that type of rate. Regionally, we're expected to see growth of 18% from now until 2026. So about 2,700 jobs over the next few years are going to become available, which is awesome. Pay, it's about $5,000 less compared to the national average in our area, but it's still a great career choice, and like I said, it is still fast growing. So the other career we're going to talk about is a clinical lab support technician. So this one you probably haven't heard of as commonly. They are not the people that are going to be working one-on-one with the patient. They're not going to be probably working directly with you. They're more behind the scenes, but they definitely have they're definitely very important in the medical setting. So they are highly trained technicians. They detect the presence of disease. They help assist different physicians in like treating your disease. They'll actually take the specimens that the phlebotomists get, and they process the information. They analyze all the different materials that they'll get. So the blood, the stool, all of that. They'll analyze that, and then they'll use those materials to find and treat different diseases and conditions. So just like the phlebotomist, they can be found, especially in labs. They're going to be in labs everywhere. Hospitals, they can be at transplant centers and facilities, fertility clinics. There's some in veterinary clinics. So it's kind of lots of flexibility on where you can work. The same with the phlebotomist. There's also a lot of flexibility in the hours you can work, because most of these facilities that the clinical lab support technicians work in are open 24 hours a day, 7 days a week. So if you have a family, if you're on the go all the time, if you like to travel, that's pretty beneficial there. This one will require a 2-year degree, and most states also require a certification that you have to pass. I know they recommend, like in high school and different courses that you can just choose to take in college, they recommend lots of biology, lots of math, lots of chemistry, just other science classes, and they also recommend that you volunteer at one of these places just to get your feel for it, see how it is in the field, like most places. So the median salary is about $54,000 a year. It is supposed to grow about 11% between 2020 and 2030. So the pay rate is expected to go up. So it is faster than average here. Also, just like the phlebotomist, the growth rate is extremely great. The national expected average is about 7% growth between these next 10 years. We're looking at like 21,600 new jobs. Regionally, it's actually a percent higher than the national average, and it's at 8%. We're expected to see 310 jobs per year in just Kentucky alone. So, like I said, clinical lab support technicians don't work directly with the public and with their patients, but they are just as important in any disease and condition finding, helping with your treatments, helping the doctors to figure out exactly what's going on and which route they should take. So these two career choices are very similar, as in they are testing, so phlebotomist, I guess the difference I would start out with, the phlebotomists are the ones that are actually going to take the samples and collect everything for you. They're going to be working one-on-one with the patients. The clinical lab support technician is going to be taking those testing materials, taking all of the biological materials that the phlebotomists collect, and they actually test them. So if you're looking at either job, the phlebotomist is great. It is going to be obviously a little bit lower pay, but there's no school, no long-term school. So go for a year, get your certification, and you're good to go there, making decent amount of money. Lab support technician, you will have to put in a little bit more work. You're going to have a 2-year degree, but you do make quite a bit more money. You do have lots of options for jobs, just like the phlebotomist. You will be more critically thinking, more working on your feet. They do work long hours, so they will be on their feet a lot. But these are both two great options. If you don't mind messing with blood and you don't, get queasy or anything like that, both of these jobs would be very great. And they are both expected to climb in the next few years. So thank you for tuning in with me, and hope you have a good day.